As an individual experiencing foot pain, you may be surprised to find out that a solution can come from something as seemingly unrelated as an umbilical cord. I'm Houston Podiatrist Dr. Andrew Schneider. We're now using a compound known as Wharton's jelly, a substance derived from umbilical cords, to treat a range of foot and ankle conditions. In today's video, we'll discuss what an injection of Wharton's jelly may do to heal your foot or ankle issue. We'll also hear testimonials from professional athletes about their experience with these injections. Before I move on, let others know about these videos. Please like, comment, hit the subscribe button, and share on social media. This will help others find the information they need.
I was lucky enough to be a part of a Super Bowl winning team with the Giants my second year in the league. Super Bowl 46. 7 minutes to go to the game, and I was running a route, 12-yard in cut. My foot got stuck in the turf, and I actually tore my ACL. My football career was never the same. It ended up being the reason I retired from football. I don't want to be living with knee pain the rest of my life. The procedure was fast, painless, very easy, stopped in. It only took about 15 minutes, and now I'm on my way to help my life.
That was former Super Bowl champion Jake Ballard, who was successfully treated with Wharton's jelly injections into his knee. Wharton's jelly is a gelatinous tissue found within the umbilical cord. It contains collagen types 1, 3, and 5, elastin, and fibronectin, which provides a natural scaffold for cellular adhesion. Additionally, it's rich in long-chain hyaluronic acid and various cytokines and growth factors. These components are essential for cellular growth and repair. Wharton's jelly is considered to be regenerative medicine. That means that these substances contained in these injections are naturally derived and stimulate your body's ability to heal itself. In my practice, it fits right in with shockwave therapy and PRP, platelet-rich plasma. I'm thrilled to add another regenerative medicine treatment. The Wharton's jelly used in medical treatments is processed from donated umbilical cords. The processing preserves the structural integrity and original characteristics of the Wharton's jelly, ensuring its effectiveness in treatment. The processed product is sterilized and made suitable for injection into others. The Wharton's jelly injection is a structural connective tissue allograft. It's intended for homologous use, meaning it's used to replace or supplement missing or damaged tissue at the site of a structural deficit. That makes it an excellent solution for treating foot and ankle conditions, where it can provide both cushioning and structural support to the affected area. Wharton's jelly injections can be particularly beneficial for foot and ankle conditions such as plantar fasciitis, Achilles tendonitis, and ankle arthritis. By providing a natural regenerative solution, it can help to alleviate pain, reduce inflammation, and promote healing in those areas. Take a minute to listen to retired professional baseball pitcher Bret Saberhagen discussing his experience with regenerative medicine, specifically injections of Wharton jelly.
I wish I knew about regenerative medicine while I was playing and not afterwards. I think it would have made a huge difference with the amount of injuries that actually probably started as a minor thing, but grew and had more effect on having surgery, because if I would have had those aches and pains and I knew about regenerative medicine, I probably could have stayed away from surgeries. I don't know how many shots of cortisone I've had in numerous areas. Even in my finger at times, I had a tendon sheath that was, and my index finger on my pitching hand was inflamed, and I was getting shots of cortisone. Well, come to find out, cortisone doesn't help your body whatsoever. It deteriorates your joints and your ligaments and tendons. It's not a good thing. It's a quick fix for you. You'll feel better really soon, and you're able to go back out there and compete for your team and get back out on the playing field, whatever that sport might be. But in the long term, it does more damage to your body than what the regenerative medicine does, where regenerative medicine is going to go into that joint, that ligament, and really help mend those issues rather than doing long-term damage. Regenerative medicine has worked for me, and I've seen it firsthand, and I can't tell you how grateful I am for that.
As you heard, Bret was treated with cortisone injections for most of his career. If you've tried cortisone injections for your foot or ankle pain in the past, you'll find that Wharton's jelly offers a different approach. While cortisone injections are anti-inflammatory, they can also weaken tissue over time and may have side effects. In contrast, Wharton's jelly promotes healing and tissue regeneration, providing a more long-term solution with fewer risks. The use of Wharton's jelly in podiatry is a testament to the incredible advances in regenerative medicine. This substance, previously discarded after childbirth, now offers a promising solution to foot and ankle pain. If you're struggling with such a condition, it's worth coming to the office for us to discuss if it's the right treatment for you. Thanks for taking the time to watch this video. Please take a moment to like, comment, and share on social media. Be sure to hit subscribe so you won't miss another video. If you've been dealing with foot or ankle pain that just seems to linger, let's consider regenerative medicine. Whether it's shockwave therapy, PRP, or Wharton's jelly injections, the results we're seeing are nothing short of phenomenal. The link to request an appointment is also in the description. Thanks so much for watching, and have a great day.